Hi, this is Rick. I am a combat veteran, social worker, trauma and addictions counselor, and welcome to Warriors Respite. First, I want to invite you to my Twitter page. My Twitter handle is at LBRT social work. So at LBRT social work. You can find my shirts on Etsy, etsy.com/shop/ Richard Rogers LCSW. Also, you may visit my website, rickrdgrs.wixsite.com/Rick Rogers, Rogers with a D, LCSW. And you can also find me on YouTube, Richard Rogers, MSW, LCSW. Again, that's Rogers with a D. So, first, I want to bring your attention to this Guardian article. And I've been reading reports on the CDC studies and NAMI, National Alliance for um, Mental Illness studies reporting problems with children with mental health issues. I've actually read like people in general having problems with mental health issues in relation to COVID, which like we knew this a couple of years ago that drugs and alcohol use was going up because people were hauled up in their houses unable to work and bored and not doing anything and just living off unemployment. But now, instead of doing anything about it, things have gotten worse because we're not really putting enough emphasis on mental health. So, our country faced a lot of fears, isolation, uncertainty with the pandemic, and 40% of parents are reporting that they are extremely or very worried about their child struggling with anxiety and depression. So, according to the CDC, one out of every three teenager in America reported that the state of their mental health was poor. Two out of every five teenagers felt persistently sad or hopeless. And according to NAMI, the National Alliance for Mental Illness, suicide is the second leading cause of death among people aged 15 to 24 in the United States. Nearly 20% of high school students report serious thoughts of suicide, and 9% have made an attempt to take their lives. Certainly a sad state of affairs. Uh, 200,000 children lost one or both their parents, and millions have saw relative and acquaintances get sick and die. So these children are told that they are at risk and they have to wear masks and they got to wash their hands, which washing your hands is probably pretty important. And I'm not saying wearing a mask isn't important. I'm not saying it is or isn't. But millions stopped attending school and were isolated. And we're told mommy and daddy might die. Grandpa and grandma might die. And maybe they did. Maybe they weren't able to let out the energy in sports and play with one another. Not to mention, they weren't working. Parents weren't working. And then we got some money from the government, but there was a shortage of toilet paper. Some people probably weren't able to eat as much as they could because the money didn't come in fast enough. And so, and then we got people struggling to pay their rent. Kids are worried about that. What can they do? They feel helpless, hopeless, can't eat, can't live. Not to mention the amount of children that spent 6 to 8 hours online every day. I know if I take my daughter away from the computer, she has withdrawals and gets very angry with me. 32% of teenage girls said that when they felt bad about their bodies, Instagram made them feel worse. More than 40% of Instagram users who reported feeling unattracted said the feelings began with Instagram. And about 25% of teenagers who reported feeling not good enough said it started on Instagram, Facebook, Snapchat, Twitter, TikTok, blah, 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 and yada, 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 and so on. Not to mention, when they do return to school, kids feel unsafe because the amount of reports of shootings in the street and in schools. And now we're doing school shooting drills. Kids are afraid and depressed and suicidal and overworried, getting sick. And not everybody can afford insurance and medical care. And I'll tell you what, these Medicaid and Medicare is inefficient. Medicare, not so much. It is a hassle to become credentialed with Medicare. Medicaid's inefficient. It's the fact of the matter is, here in Indiana, Illinois, as a social worker, I can bill Medicaid. In Indiana, I need a psychologist, an HPSS, to bill Medicaid. And there's a big problem with that because most psychologists don't know what they're doing, don't know how to bill Medicaid. I need a psychologist to sign off on treatment plans. And I tried doing that. I found a psychologist that was willing to do that, but then they quit on me because it was too much to figure out how to do it. And it was too much to do the training to do it. Psychologists don't want to do that a lot of times, even though they get a nice, easy cut of the money, which, heck yeah. But I wasn't able to take a lot of Medicaid patients, especially when I was doing private practice. I do private practice part-time now in Indiana and Illinois, online. But I can't take Medicaid in Indiana. I'm not credentialed in Illinois anymore because I'm using growth therapy. But it's inefficient. Yes, I can understand that it's more strict to become a PhD in psychology, but maybe that's the problem. Because I would go and take the testing and stuff to get into the PhD psychology school and hopefully get accepted, having to write a paper and find referrals and stuff like that to get me into the psychology program. But on top of that, it cost hundreds of thousands of dollars, maybe not hundreds of thousands, tens of thousands of dollars to become a psychologist. And I think the fact of the matter is, I already am pretty efficient as a addictions and trauma therapist. Number one. Number two, I do not feel like going into debt. I have learned from psychologists in the field. And that's the essence of social work, is we learn in the field. I've learned from psychologists and licensed professional counselors and licensed mental health counselors and licensed marital and family therapists and certified alcohol and drug counselors. Now, the thing about social work that separates them from social work is that when you go into becoming an applied behavioral analyzer, whatever, you're pretty much stuck working with autism. When you become a certified alcohol and drug counselor, you're stuck working with alcohol and drugs. As a licensed clinical social worker, it's a general thing. I can do just about anything. I can do more with my license that anybody else can do with their license. I'm not stuck in a box. I like the box that I'm in, but I can leave my box if I feel like it. That's the essence of this. Right now, my city's hiring a police social worker. I can go become a police social worker. I like what I'm doing now. Anyways. But, like, I got unlimited options. Where if I was a psychologist, I'm kind of stuck doing very minimal things. And people like doing that, and that's fine. And I'm not saying there's anything wrong with being in that box. I'm just saying I don't want to be stuck in that box. And I don't want to go into debt. And therefore, Indiana does not allow me to bill Medicaid. And you can't blame me. You got to blame the state. The state is not allowing Medicaid to be billed by a proper amount of people. And there are people, and when it comes with Medicaid, we're talking about low resources. We're talking about poverty. We're talking about people that probably are, a lot of them, depressed. And they can't get the mental health services because not enough people can take Medicaid. And so these children can't afford mental health services. So what are they supposed to do? And I know I've had people try reaching out to me, trying to get me to do free services. But, I mean, let's be honest, is it all medical doctors going to give free services all the time? Yeah, I can donate my time sometimes, but I can't take a bunch of too many free services because the government doesn't cover, because the government's too efficient. That's a problem. And I have written to the state senator about that a couple times, and still nothing. So we'll be right back, and then we will talk about what we can do to help our children. And welcome back to Warriors Respite. Let's talk about helping our children with high anxiety and depression. So I think the first step is recognizing the signs and symptoms that there is something going on with our child as parents and guardians. Is there persistent sadness or loss of interest in activities, loss of interest in sports? Are they withdrawing themselves from social situations? Are they have too much social anxiety? Are they eating too much? Are they eating too little? Are they sleeping too much? Are they sleeping too little? Are they up all night with racing thoughts? Are they expressing that they're hopeless or that they want to self-harm? If they're opening up about their feelings, it's important to listen and validate their emotions without judgment. Because I don't know about you, but when I was a kid, I was told, don't be a Sally. Suck it up. I'll give you something to cry about. Now, we need to offer, and this is me talking as a war veteran who knows what it's like, what you need to do to be tough. I've taken my body. I'm no Ranger. I'm no Navy SEAL. But I still have taken my body beyond limits that I thought that it can go at one point. Not anymore. But create a safe space for your child. I hate that word, safe space. But that's the masculinity in me. I think I talked about that last episode, saying words like safe space. But that's probably the bullies from when I was a kid telling me to suck it up, save space, look past your own perceptions and the values that your parents put on you. Help them feel comfortable in discussing their thoughts. Create lines of open communication and establish emotional support. Allow your children to communicate openly That's crucial. Be encouraging and let them discuss their feelings and experiences. Listen actively to what they're saying. Don't interrupt. Don't criticize them when they're communicating. Don't dismiss emotions or compare their problems. Don't tell them it ain't so bad. I think all our trauma is just as important as anybody else's. Yes, I think it's important to compare for us to see how grateful we are, but we don't want to, or to be more grateful, if I can talk right. We don't want to do it in a condescending way. So be empathetic, be reassuring, be understanding, and start discussing coping skills like journaling, uh, being crafty, being creative, coloring, maybe even if you can, making an appointment with a professional. And encourage a healthy lifestyle. You should be leading by example with this. I know I need to get on the wagon, but physical exercise, balanced diet, proper sleep, it should be encouraged. I know most of our problems can be solved. Most of our depression and anxiety can be solved by getting proper sleep. But endorphins are released with physical activities. Endorphin endorphins are a neurotransmitter that, quite honestly, is released when people use opiates. It gives a feeling of well-being, and you don't need to risk using opiates and overdose to get a feeling of well-being. You can exercise. Instead of being on the computer all day, which we talked about can be challenging to get our kids off the computer, but encourage outdoor activities, connecting with nature. In fact, limit screen time. Support social connection. This is especially important for children to adjust even after much time has passed since the pandemic. And then, you know, break the stigma of seeking professional help. Hopefully, I'm wrong. I just know with my experiences, I've known a lot of people that have not been able to get professional help. Not the professional help they need, because maybe they can get in with Medicaid, but they won't see their therapist as much as they could. Maybe they'll see them every couple months because the therapist is too booked. But if the anxiety and depression worsens, you do want to find a way to seek professional help. Have consultations with specialists, especially in adolescents and children. They have the capability of assessing your child's condition and recommend treatment options. It may be helpful to get them in therapy or medication. I'm not going to dog medications when it comes to mental health. A lot of people do not like it. I know social workers that don't like it. I ain't going to dog it because maybe that's what helps somebody. Maybe you need a combination of therapy and medications. But I know, especially me, when I pretty much was raised from the age of 17 in the military, in the infantry, and there was a big stigma with seeking mental health. And there's a lot of people that don't believe in mental health. Mental health is not weakness or failure. You need to challenge that stigma. It's just an important step to exhaust all options, especially if your kid's struggling with suicide. So if you're one of those people that have that bullcrap stigma of mental health, you're hurting your child. And if you have, and usually it's funny, The people who have that stigma and are resistant usually are the people that need it most of all. Ensure your environment is supportive, though. Um, ensure the home is a supportive atmosphere. Positive communications, not with you, just with you, but with all family members. Set reasonable expectations. Celebrate each other's achievements. Everybody's achievements, no matter how small. Make them feel good. Help them with problem solving skills, building resilience, and managing stress. And be a model for self care. Ensure well being is being met. Show your child it's important for them to take care of themselves. And finally, seek your own education. Read articles, listen to this podcast, read my blogs, read other blogs, take classes on education, anxiety, or on depression, anxiety, suicide prevention, online resources, workshops, seminars. Knowledge of these things will help you better understand your child and help you break down the stigma surrounding your child. So supporting a child who is having problems with depression and anxiety can be challenging, but you can make a significant difference as a parent. You are not alone in this journey. Find support groups if you need to, because you need support too. Especially when we're talking about family members that have problems with addiction, and the supporters of the ill end up becoming more sick than the individual because they're more worried about their mental health than the individual is. So seek your own help, your own therapy. Talk to NAMI. Recognize the signs, encourage open communication, promote healthy lifestyle. Find a professional when the help is needed. Create a healthy and supportive environment. Find education for yourself. But most of all, be a crucial part of your child's support as they navigate the challenges and create a path towards resilience. Well, that's all for today. I really thank you for joining me. Please join us next time on Warriors Respite. This is Rick Rogers, MSW, LCSW, former infantry combat vet, and it was nice talking today. Good day, good weekend.